Every hospital, county, and clinic has its own way of handing out the vaccine. Some people are in and out in 5 minutes, while others wait up to 8 hours for that shot in their arm.
It really is incredible. CBS 17's Bridget Chapman tried to find out if there's just a more efficient way to do this and if the process will be refined as we get more doses.
Waiting by foot and car, senior citizens lined up across our area for COVID-19 vaccines this week.
They've been such an enthusiastic crowd, and they're very grateful.
Dr. Sam Fleischman says they vaccinated around 1,500 people 75 and up this week at Cape Fear Valley Health. They've started with first come, first serve, aiming to vaccinate 300 people a day.
Every day we've learned a little bit more about how we're going about doing it, and it's getting better all the time.
He says they've worked on traffic control and are looking to register people for time frames in the future.
To help that kind of flow would be tremendous, and we could be even more efficient and get more people through the system.
Nash County health officials vaccinated about 1,000 people at their first clinic. It was an all-day first-come, first-serve event. Many waited upwards of 8 hours, leading the health department to want to move to appointments only, like several other counties and health systems are doing.
I think everybody's kind of doing their own thing in some respects.
That's because the state hasn't offered guidance on how to vaccinate people. Most places are doing it based on how they've done past clinics like flu shots. They're also doing trial and error.
People are looking for perhaps some way to share some best practices. There really hasn't been a process around that.
State health officials say they can provide staff to help if needed, whether that be for office work, data entry, or administering vaccines.
Folks just need to raise their hand, use the same process that we go through if we're in a hurricane, to use that request process. As health workers try to vaccinate as many people as possible, as quickly as possible.
So the second half of 2021 is a great year for everyone.
Reporting in Raleigh, Bridget Chapman, CBS 17 News.
And we did ask the state if they would at least consider a platform for health systems and counties to share their best practices with each other. We'll let you know if and when we hear back. In the meantime,